بسم الله الرحمن الرحيم. أهلا وسهلا بكم في محاضرة الأسبوع هذا وهي الأنكسيتي disorders. أنا الطالبة رجاء البسيوني وهذا البحث مقدم إلى الدكتور عبد الكريم رضوان. Normal anxiety التوتر أو القلق الطبيعي. Everyone experience it. من الطبيعي الشعور بالقلق من حين لآخر وخاصة إذا كانت هناك ضغوطات وحياة مرهقة. التوتر تجربة طبيعية وبيشعر الجميع بالتوتر في فترة من فترات حياتهم. ممكن يكون السبب من الشغل أو من مثلا الحياة الاجتماعية. ممكن يتسبب أي نوع من هذه الضغوطات في حياتك بالتوتر. التوتر بخليك تشعر بالبرسبشن، الهيديك، الصداع، palpitation, tightness in the chest, mild stomach discomfort and restlessness indicated by an inability to sit or stand still for long. ممكن يكون التأثير الأنكسيتي من شخص إلى آخر بيختلف، كل واحد بيختلف عن الثاني. وبالرغم من إنه القلق أو الأنكسيتي شعور عادي وبيكون رد فعل طبيعي للأحداث الصعبة، لكن أحيانا بيزيد وبيكون ما له علاقة بالأحداث اللي بتصير، وفي هذه الحالة بتحول من شعور إلى مرض. Definition of anxiety. Anxiety is an emotional state. هي حالة شعورية caused by perception of real or perceived danger that threatens the security of an individual. It allows a person to prepare for or react to environmental change. Everyone experiences a certain amount of nervousness and apprehension when faced with stressful situation. كلنا بنتعرض للانكزايتي ولكن ردات الفعل بتختلف من شخص إلى آخر. Anxiety can produce uncomfortable and potentially debilitating psychological, such as worry or feeling of threat, psychological arousal such as tachycardia or shortness of breath. If it becomes excessive, إذا زادت عن معدلها الطبيعي, some individuals experience persistent severe anxiety symptoms, أعراض حادة, and possess irrational fear that significantly impair normal daily function. يعني يعتبر التوتر حاجة كويسة ونورمال لما ما تزيد عن حدها، لكن إذا زادت عن حدها بتبقى بعد هيك حتعمل لي impairment of function، خلل في الوظائف الحياة اليومية. يعني بصير الشخص ما يروح على الامتحان، ما يروح على شغله، بعد هيك حتعمل disorder. يعني إذا كانت excessive وزيادة عن اللزوم مأثرة على حياتي مع الآخرين بتكون disorder. Is anxiety adaptive? Anxiety and fear both are alerting signals and act as a warning of an internal and external threat. Anxiety can be conceptualized as a normal and adaptive response that has life-saving qualities and warn of threat. يعني يعتبر القلق عادة شعور طبيعي إذا كان ما زاد عن حده. It promotes a person to take the necessary step to prevent the threat or to lessen its consequences. يعني لما يكون عندنا امتحان نحس ببعض القلق، أو ممكن يكون بعض الشعور بالقلق أمر كويس ونورمال، ممكن يخلي البعض إنه يصير بدرس أكتر، بجتهد أكتر. لكن إذا بعد الامتحان ما راح شعور القلق أو ضل شعور القلق ملازم إليه، هذا ممكن يتحول لديس أوردر. هذا معناه إنه في مشكلة. ممكن يزداد عن الانكزايتي سوء مع مرور الوقت، لكن الأعراض بتختلف من واحد إلى الثاني. Anxiety prevents damage by alerting the person to carry out certain acts that forestall the danger. Anxiety disorders are among the most frequent mental disorders encountered in clinical practice. Anxiety disorders من أكثر الأعراض النفسية شيوعاً. Healthcare professionals often mistake anxiety disorder for physical illness, and only 23% of patients receive appropriate treatment. يعني فقط نسبة 23% من المرضى اللي بيتلقوا العلاج الصحيح أو المناسب. Failure to diagnose and manage anxiety of disorder result in negative outcome, including overuse of healthcare resources, increased morbidity and mortality. التشخيص الخاطئ طبعا بيزود الموربيديتي والمورتاليتي. Prevalence of anxiety disorders decrease with higher socio-economic status. في أعراض نفسية ممكن تكون عند الومن أعلى من المن، وفي أعراض نفسية ممكن تكون عند المن أعلى من الومن، لكن الانكسيتي disorders reported more by women than men. بتكون أكثر شيوعا في الومن عند النساء أكثر من الرجال. Fear bias phobia. Fear protect you from danger. إنه بيحميك من إشي خطير. الخوف أو من خوف من إشي خطير، لكن الفوبيا have little to do with danger. إنها ما بتتعامل مع أشياء خطيرة، يعني ممكن أنا يعني فوبيا من أشياء مش مستاهلة مثلا. fear إنه هي خايف من حاجة واحد بيخاف منها، لكن الفوبيا إني خايفة من إشي مش مستاهل، ولازم تكون recurrent و persistent اللي هي متكررة. More than 19 million Americans have a phobia, an intense, irrational fear when they face a certain situation or activity or object. With a phobia, you may know your anxiety and fear are not warranted, but you cannot help the feeling, and they can also be intense. They virtually paralyze you. The three kinds of phobia. Hundreds of different phobia have been identified. في مئات أنواع مختلفة من الفوبيا, including phobia or fear of phobia. But when talking about phobia, we are kind of anxiety disorder. Experts divide them into three categories. Agoraphobia may be escape places where public and intense anxiety difficult. Agoraphobia من agora يعني المكان الواسع. الناس أو حدا مثلا بيخاف من الأوبن سبيس في الأماكن المزدحمة زي المول مثلا. بتجيله نفس أعراض الانكسايتي، هو خايف إنه محدش حيلحقه، خايف إنه محدش help him. Social phobia and situation, social of avoidance and fear. بخاف من الأماكن العامة. Specific phobia, situation or object specific of fear, irrational. يعني خايف من أشياء معينة، من object معينة. Stress and anxiety. Whether an event is perceived as stressful depends on nature of the event. تعتمد على طبيعة الحدث and on the person resources, psychological defense على وسائل الدفاع and coping mechanism التأقلم، آليات التأقلم. All involve the ego, a collective abstraction for the process by which a person perceives, think, and act an external event or internal drives. A person whose ego is functioning properly is in adaptive balance with both external and internal worlds. يعني لما نحكي إنه هذا الشخص عنده الأساليب الإيجو functioning عنده adaptive balance. لكن إذا كانت الإيجو is not functioning properly, it may disorder such as anxiety. Classification of anxiety disorder: generalized anxiety disorders, panic disorder, phobia disorder, post-traumatic stress disorder, obsessive compulsive disorders. حتى رح نشرحهم المحاضرة هذه إن شاء الله. دي صور بتعبر عن الكلاسيفيكيشن للانكسايتي ديس اوردر اللي تم ذكرهم. هذه الصورة بتحكي عن أنواع الفوبيا اللي رح نشرحهم بالتفصيل إن شاء الله. Symptoms of anxiety. أعراض الانكسايتي: sensitiveness to the noise, dry mouth, difficulty in swallowing, صعوبة في البلع, palpitation, discomfort in the chest, awareness of missed beat, restlessness, tremor, aching muscles, constriction in the chest, difficulty inhaling, feeling of breathlessness, fearful anticipation, irritability, poor concentration, صعوبة في التركيز, worrying thought, headache, dizziness, insomnia, صعوبة في النوم, avoiding to the situational object. Pathopsychology. Pathophysiology. Data from biochemical and neuroimaging studies indicated that the modulation of normal and pathologic anxiety states is associated with multiple regions of the brain and abnormal function in several neurotransmitter system, including norepinephrine, aminobutyric acid, GABA, and serotonin. In noradrenergic model, this model suggests that the autonomic nervous system of anxious patient is hypersensitivity and overactive to various stimuli. The locus coeruleus may have a role in regulating anxiety, as it activates norepinephrine release and stimulates the sympathetic and parasympathetic nervous system. هذه الصورة بتوضح الدوبامين باثواي and serotonin باثواي. السيروتونين طبعا معروف انه بيحفز عن تنظيم مستوى السيروتونين في الدماغ ومسؤول عن المود والميموري وبروسيسنج and sleep and cognition الإدراك. الدوبامين باثواي function reward motivation تحفيز البلشر الإيفوريا الموتور function compulsion and perseveration. Generalized Anxiety Disorder اضطراب القلق العام. The diagnostic criteria of generalized anxiety disorder require persistent symptoms for most days for at least 6 months. عشان يتم تشخيصه باضطراب القلق العام نستمر عليه على أقل شيء مدة 6 شهور. Essential feature of generalized anxiety disorder is unrealistic or excessive anxiety and worry about a number of events or activity or other important area of functioning. يعني مثلا كمثال إذا كان شخص عليه امتحان أو مثلا أنتم عليكم امتحان بتحسوا ببعض التوتر، ممكن يكون الشعور بالقلق أو التوتر أمر كويس لأنكم بتدرسوا أكثر بتجتهدوا أكثر، لكن في ناس بعد الامتحان ما بتخلصوا من الشعور بالتوتر، وفي هذه الحالة يسمى هذا الشعور قلق، وقد يزداد القلق سوء مع مرور الوقت، وقد يسبب أعراض مثل كوابيس وألم في الصدر، وقد يكون الشخص لا يغادر المنزل، فيبدأ شعور القلق بالتأثير على الحياة اليومية على الفانكشنال ديلي كالعمل والدراسة والحياة الاجتماعية. يطلق على هذه الحالة باضطراب القلق العام. Anxiety Generalized Anxiety Disorder اختصاره GAD. يعني يكون القلق حول كل شيء، الدراسة والعمل والحياة الاجتماعية، ويختلف عن القلق الذي يشعر به الآخرون، بيتميز بثلاث صفات رئيسية. متواصل، إنه بيكون هذا الانكزايتي متواصل لا يستطيع التخلص من الشعور بالقلق، أو مفرط أكثر مما يشعر به الشخص الطبيعي، أكثر من الحد النورمال، وغير منطقي بيكون بدون سبب، وبحس هذا الشخص أنه شعوره مبالغ فيه، إلا أنهم لا يملكون القدرة على إيقاف هذا الشعور لأنه خارج عن قدرتهم. Generalized anxiety disorder is usually the primary disorder in patients with compromised anxious depression. Psychological and cognitive symptoms. Psychological and cognitive symptoms. كيف نعرف إذا كان أحدهم مصاب باضطراب القلق العام Generalized Anxiety Disorder. الأعراض هذه excessive anxiety قلق مستمر بدون سبب worries that are difficult to control صعب إنهم يسيطروا عليها، مش قادرين يسيطروا على هذا الشعور في داخلهم feeling tied up or on edge بيحسوا إنهم يعني على الحافة، يعني زي ما بيحكوا poor concentration or mind going blank صعوبة في التركيز. الفيزيكال symptom restlessness fatigue muscle tension muscle tension ألم في العضلات نتيجة التوتر العضلي الزائد. sleep disturbance مشاكل في النوم، إما excessive sleeping or loss of sleep. irritability. وقد تزداد الأعراض سوء عند المرور بالضغوطات، ضغوطات الحياة. Etiology. Cause of generalized anxiety disorder is not known. مسببات ال Generalized Anxiety Disorder غير معروفة لحتى الآن. Biological and psychological factors probably work together. The biological factor focus biological research effort on the gamma aminobutyric acid and serotonin neurotransmitter system. Other neurotransmitter system is generalized anxiety disorder include the norepinephrine, glutamate, and cholecystokinin system. لكن ممكن الجينات تلعب دور في الإصابة، وممكن للبيئة تلعب دور في الضغوطات بتسبب ال Generalized Anxiety Disorder. Diagnostic criteria for Generalized Anxiety Disorder. لا يوجد اختبار بيحدد إذا كان الشخص مصاب أم لا، ولكن هناك ويستند الأطباء بتشخيصهم على النسخة الخامسة من الدليل التشخيصي DSM-5 Diagnostic and Statistical Manual of Disease. وقد تم وضع المعايير هذه للتشخيص. Excessive anxiety and worry a prevention expectation occurring more day than not for at least 6 months. إنه لا تقل الأعراض اللي تم ذكرها عن مدة 6 شهور. Such as work, school or performance. The individual find it difficult to control the worry. صعوبة في إنهم يسيطروا على هذا الشعور. The anxiety and worry are associated with 3 or more of the following. لا تقل الأعراض عن 3. عن الثلاثة من هذه الأعراض اللي رح نذكرها. For many days than not for past 6 months. Only one item is required in the children. لكن في الأطفال يكفي ظهور عرض واحد. إيش هي هذه الأعراض اللي هي restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentration, irritability, muscle tension, sleep disturbance, difficulty falling or staying asleep, or restlessness unsatisfying sleep اللي هم ذكرناهم قبل هيك. The anxiety, worry, or physical symptom cause clinically significant distress or impairment in social, occupation, or other area of function. ممكن يؤدي إلى خلل في الوظائف الحياة اليومية. Treatment العلاج ممكن يكون عن طريق psychotherapy أو cognitive. Psychotherapy cognitive behavior therapy يأدرس patient hospitalized cognitive distortion directly. ممكن يغير تعليم الأشخاص طرق مختلفة للتفكير والتصرف والتفاعل. Supportive psychotherapy patient reassurance and comfort. Insight oriented therapy uncovering unconscious conflict and identifying ego strengths. Relaxation and biofeedback. الفارماكوثيرابي العلاج بالأدوية مثل البنزوديازيبين مضادات القلق. The drug of choice of generalized anxiety disorder بأنواعها اللي هي البيرسبيرون، الفينالوبيزين، وسلكتيف سيروتونين reuptake inhibitor، وأدر drug زي البيتا adrenergic receptor antagonist may reduce the somatic manifestation. أو مثلا مضادات الاكتئاب زي مثلا السيروتونين بتنظم مستوى السيروتونين في الدماغ. Panic disorder. Panic disorder begins as a series of unexpected, spontaneous panic attack involving an intense, terrifying fear similar to that caused by life-threatening danger. البانيك disorder هي اضطراب الهلع، هو من أحد أنواع anxiety disorders. بيعاني فيها من نوبات متكررة من الخوف ممكن تستمر لدقائق أو أكثر. During an attack, patients often describe an overwhelming sense of doom, a fear of dying or losing control, and at least 4 physical symptoms. خلال النوبة يحسوا بشعورهم بفقدان السيطرة أو الخوف من الموت خلال نوبات الهلع. Panic attack usually lasts no more than 20 to 3 minutes. مش أكثر من 20 ل 30 دقيقة، لكن ال peak intense of symptom within the first 10 minutes. Secondary to the panic attack, many patients eventually develop agoraphobia. بعد هيك صححهم معها الأجوراphobia. Symptom of panic attack الأعراض. Psychological symptom depersonalization, derealization, fear of losing control, fear of going crazy, fear of dying. الفيزيكال symptom abdominal distress, chest pain, ألم في البطن or discomfort عدم الارتياح, chill, dizziness, دوخة or lightheadedness, feel of shocking, hot flush, palpitation, nausea, shortness of breath, sweating, tachycardia, trembling or shaking. تشخيص diagnostic criteria for panic disorder. Recurrent unexpected panic attack. A panic attack is an abrupt shock, intense fear or intense discomfort that reach a peak within minutes and during which time 4 or more the following symptoms occur. 4 من هذه الأعراض أو أكثر. Note, the abrupt shock can occur from a calm state or an anxious state. ممكن تجي نوبة الهلع هو كالم هادئ أو في الانكسيوس state. هذه الأعراض هي palpitation, pounding heart or accelerated heart rate, sweating, trembling or shaking, sensation of shortness of breath or smothering, feeling of shocking, chest pain or discomfort, nausea or abdominal distress, feeling crazy, unsteady light-head or faint, chill or heat sensation, paracentesis or numbness or tingling. الشعور بالتنميل. Clinical features. First, panic attack is often completely spontaneous. تكون بشكل مفاجئ. Although panic attack occasionally follow excitement, physical excretion, sexual activity, or moderate emotional trauma. تكون نتيجة التروما. The attack often begins within a 10-minute period of rapidly increasing symptoms. The major mental symptoms are extreme fear and sense of impending death and doom. يكون عندهم خلال النوبة الشعور من الإحساس بالخوف من الموت أو فقدان السيطرة. Patients often try to leave whatever situation they are in to seek help. The attack generally lasts 20 to 30 minutes and rarely more than an hour. يعني نادر لما بتكون ساعة، لكن هي في الوقت العادي ممكن تكون 20 ل 30 not more. Between attacks, patients may have antipsychotic anxiety about having another attack. Prognosis. A panic disorder in general is a chronic disorder, although its course is variable. About 13 to 14% symptom-free at long-term follow-up. Like about 50% have symptoms that are sufficiently mild not to affect their lives significantly. About 10 to 20% continue to have significant symptoms. Treatment. الفارماكوثيرابي ممكن نعطيه قبل البرازولام أو كلونازيبام. السايكوثيرابي cognitive and behavior therapist. Agoraphobia. أجورا معناها المكان الواسع، لكن الأجوراphobia هي الخوف من الأماكن الأوبن سبيس في الأماكن المزدحمة زي المول. Anxiety about or avoidance places or situations from which escape may be difficult. or embarrassing, or in which help may not be available in the event having a panic attack or panic-like symptom. Fear typically involves characterized cluster of situations that include being outside of home and outside of the home, outside the home alone, being in a crowd or standing in the line, being in a bridge and traveling in a bus, train or automobile. يعني الشخص بتجيله نفس أعراض الانكزايتي وخايف إنه محدش يلحقه، محدش cannot help him. Specific phobia. Natural environment type. Fear is caused by objects in the natural environment such as storm, height or water. Generally has a child honest. Fear of water, agoraphobia. الهايت agoraphobia. Lightning and thunderstorm, astrophobia, or aging, grasscophobia. Animal type. Fear is used by animal or insect and general has a childhood honest. Situational type. Fear of small confused space, claustrophobia or the dark, nyctophobia. Blood injection, injury type. Fear is caused by seeing blood or an injury are perceived an injection or other invasive medical procedure, highly familiar and often characterized by the strong vasovagal response. Tympanophobia, fear of blood, hemophobia, and fear of getting injection. Social anxiety disorder, social phobia, is characterized by an intensive, irrational, and persistent fear of being negatively evaluated or scrutinized in at least one social or performance situation. Exposure to feared circumstance usually provokes in an immediate situation-related panic attack. السوشيال فوبيا إنه شخص بيخاف يكون وسط المجتمع، لو حضر أي مناسبة مثلا ما بيروحها، بيكون مستمتع وهو قاعد لحاله في البيت، لكن ما بيحب يطلع مناسبة، ما بيحب يروح لأنه بيخاف إنه الناس تتنمر عليه أو مثلا من السيلف evaluation. Blushing is the principal physical indicator and distinct social anxiety disorder from other anxiety disorder. Adults with social anxiety disorder usually recognize their fear is excessive. هم بيكونوا عارفين إنه إحساسهم هذا مبالغ فيه، إنه ال fear is excessive، إنه زيادة عن الحد الطبيعي and unarousable. However, they are unable to overcome it without treatment. In individuals under 19 years of age, the duration of symptoms is at least 6 months. The fear of avoidance is not caused by a drug or other substance such as cocaine or general medical or psychiatric disorder. طبعا بيكون في الwomen أكثر من المن، وبتكون فترة it is a chronic disorder with a mean duration of 20 years. الفير being scrutinized by other, being embarrassed, being humiliated حكيناها. Some feared situation he addressing a group of people eating or writing in front of other, interacting with authority figures, speaking in public, talking with strange, use of public toilet. Physical symptom blushing, butterflies in the stomach, diarrhea, sweating, tachycardia, trembling. في عنا نوعين types إلها. Generalized type. Fear and avoidance extend to wide range of social situations على مستوى مثلا wide واسع من المواقف. لكن non generalized type fear is limited to one or two situations لموقف أو اتجاه واحد. Diagnostic criteria for social anxiety disorder: marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. Example include social interaction, having a conversation, meeting unfamiliar people, ناس هو ما بعرفهم, being observed بحيث إنه في حدا دايما بلاحظ وفي حدا بيراقب فيه, and performance in front of others. In children, the anxiety must occur in peace setting and just during interaction with adults. The individual fears that he or she will act in a way or show an anxiety symptom that will be negatively evaluated, such as will be humiliating or embarrassing, will lead to rejection or offend others. The social situation almost always provoke fear or anxiety. In the children, the fear of anxiety may be expressed by crying, tantrum, freezing, cleaning, shrinking, or failing to speak in social situations. The fear of anxiety is out of the proportion to the actual threat posed by social situation and to the social cultural context. The fear, anxiety, or avoidance is persistent, typically lasting for 6 months or more. أكثر من 6 شهور. If the fear is restricted or to speaking or performance in public. هذا ممكن برضه تكون ملاحظة. Treatment both psychotherapy and pharmacotherapy. الفارماكوثيرابي بالعلاج طبعا السيروتونين is the first line treatment, البنسوديازيبين, الفينيلافلازين, buspirone as added to in the severe cases, irreversible aminoaminotic acid such as phenolazine or meclopramide. In the case performance situation, beta blockers such as atenolol and propranolol. Psychotherapy combination with behavioral and cognitive method, including cognitive retraining, de-arousal rehearsal during session, and a range of homework or assignment. Obsessive compulsive disorder برضو واحدة من anxiety disorder is one of the 10 leading cases of disability. واحدة من الأسباب اللي بتسبب disability. Patients with obsessive compulsive disorder experience a significant impairment in their quality of life with reduction in social, family, and occupational function. Affect for more individual than was thought in the past. بتأثر أكثر من الماضي. Because the natural and potential severity of sign and symptom and resultant negative effect on QOL, obsessive compulsive disorder, is considered a major medical condition. Clinicians should be able to identify obsessive compulsive disorder and understand the current treatment option. There is no exact cause for this condition. Repetitive thought هي عبارة عن repetitive thought أفكار متكررة feeling contaminated after touching an object debating whether the stove was turned off repetitive image صورة متكررة recurrent sexual explicit picture repetitive impulses need to symmetry or putting things in specific order impulse to shut out obsessed and a crash. لكن الcompulsive repetitive activities such as hand washing, checking, ordering, need to ask, need to confuse, repetitive mental act, counting, repeating words, silently praying. طبعا أنا ممكن أسأله إنه بفكر إنه بيجيك الصوت من برا أو من جوا دماغك عشان أفرقه عن الhallucination. Drug-induced anxiety في عنا drug are the most common cause of anxiety symptom. ممكن في أدوية ممكن تسبب anxiety occurring during the use of central nervous system stimulating drug in a dose-dependent manner, but ingestion of minimal amount can result in marked anxiety, including panic attack in some individuals. The onset of drug-induced anxiety is usually rapid. After the initiation of therapy, look for the recent drug or dosage change to rule out drug etiology for anxiety. Anxiety occurs occasionally during the use of central nervous system depressant, especially in children and the elderly. However, anxiety complaints are more common as a complication of drug withdrawal after the abrupt discontinuance of these agents. The drug associated with anxiety symptoms are anticonvulsant, antidepressant, antihypertensive, antibiotic, البرونكودايليتور، الدوباغونست، في أنواع تانية. Medical disease associated with anxiety. Common medical illness associated with anxiety symptom زي cardiovascular anxiety, الأنجينا، التفحص الصدرية، الريتمس، cognitive heart failure, ischemic disease, myocardial infarction, endocrine and metabolic, Cushing disease, hyperparathyroidism, hypoparathyroidism, hypoglycemia, hyponatremia, neurologic dementia, migraine, Parkinson disease, seizure, stroke, respiratory system asthma, chronic obstructive pulmonary disease, pulmonary embolus, pneumonia, or others such as anemia, systemic lupus erythematosus. The treatment for anxiety disorder often require multiple approach. The patient may need short-term treatment with an anxiolytic such as benzodiazepine to help to reduce the immediate symptom combined with psychological therapies and an antidepressant. الانتيديبريسنت برضو بتعالج الانكسايتي والدبريشن for longer term treatment and the prevention of symptom return. السايكوثيرابي اللي هي cognitive behavior therapy. The specific psychotherapy with the most supporting evidence in anxiety disorder is cognitive behavioral therapy. Focuses on the here and now and explore how the individual feel about themselves and other and how the behavior is related to this thought. نخليه يكتشف الشعور الحالي تجاه الآخر، تجاه نفسه وتجاه الآخرين. Thought individual therapy or group work, the patient and the therapist identify and question maladaptive thought and help develop an alternative perspective. Individual goal and strategies are developed and evaluated with the patient encouraged to practice what they have learned between sessions. Therapy usually lasts for around 60 to 90 minutes every week for 8 to 16 weeks or longer in more resistant cases. Specific phobia are also exclusively treated using exposure technique, and most patients will respond to this treatment. Only a very few will require additional drug therapy. Pharmacotherapy زي ما حكينا عنهم البنزوديازيبين are the most common prescribed to provide immediate relief symptom of severe anxiety. All benzodiazepines have sedative, hypnotic, anxiolytic, amnesiac, muscle relaxant, and anticonvulsant action, with a minor difference in the relative potency of these effects. هذا بتوضح اللي هي symptom common of anxiety states. وهنا symptom relatively specific to benzodiazepine withdrawal. الانتي ديبريسانت لها تأثير كبير في العلاج الانكزايتي. selective serotonin reuptake inhibitor وترايسايكل انتي ديبريسانت ومونوامين اوكسايد inhibitor. الأدر ميديكيشن اللي بنستخدمها في الانكزايتي هي فقط للعلم الهيدرولازين، الانتي سايكوتيك، البريجابلين، البيوسوبيرون، البروليدول and oxybenzodone. Nursing diagnosis for anxiety disorder, panic anxiety. Panic anxiety related to to real or perceived threat to biological integrity or self-concept, evidenced by any of all physical symptoms identified. The diagnostic mystical 5. Short-term goal: the client will verbalize a way to intervene in escalating anxiety within 1 week. A long-term goal: by discharge, the client will be able to recognize the symptom of anxiety honest and intervene before reaching panic level. Nursing intervention for panic anxiety: develop a trust relationship through communication for communication value. تبني علاقة جيدة ما بينك وبين المريض. Stay with the client and offer reassurance of safety. تأكد من الأمان. Maintain a calm staff and client non-threatening matter of fact approach. Use simple words and message spoken calmly and clearly to explain any procedure. Decrease environmental stimuli. Administer PRN tranquilizer when level of anxiety decrease. Explore possible reason for occurrence. Help the client recognize percepting factor. Help the client to recognize early sign. Teach the client way to interrupt escalation of signs. Progressive relaxation, breathing exercise or physical exercises. Nursing diagnosis for ineffective coping. Ineffective coping related to underdeveloped ego, punitive super ego, avoidance learning, biochemical change, obsessive compulsive disorder, or repressed anxiety, or severe psychosocial stress. Ineffective coping evidenced by realistic behavior, obsessive compulsive disorder, verbalized of numbness, physical complaints, self-centered, presence of physical symptoms with no pathophysiology, sudden travel away from home with inability to recall previous identity. Outcome: short-term goal: client will decrease persistent in realistic behavior by half within 1 week. The client will verbalize understanding of correlation between physical symptom or dissociative behavior and anxiety or stressful psychosocial stress. Client will verbalize more adaptive ways of coping in stressful situations than restoring to discussion or physical complaint or symptom. Long-term goal: client will demonstrate the use of healthy coping strategies without returning to previous unhealthy coping. Nursing intervention for ineffective coping: develop a trust relationship through communication acceptance, reassuring the client for safety and security by your presence, accept the client behavior, give space and allow realistic behavior of complaint of the beginning treatment without judgment. Initially meet the client's dependency need as required. Identify the factor or stressor that will state severe anxiety. Support the client and help him. Provide a structured schedule to depart from the unwanted behavior. Explain the new physical complaint will be referred to the physician with no further attention. Help the client to learn way to interrupt unhealthy behavior. Discuss possible alternative coping strategies. Give positive reinforcements. Summary of anxiety disorders. Symptoms common to all anxiety disorders here: fear or worry, sleep disturbance, concentration problem, dry mouth, sweating, palpitation, GI discomfort, restlessness, shortness of breath, avoidance behavior. Generalized anxiety disorder: restlessness, short of breath, avoidance behavior. Generalized anxiety disorders is persistent, free-floating, excessive, and inappropriate anxiety on most days for at least 6 months. The anxiety is not restricted to a specific situation. Manic disorder, with or without agoraphobia, recurrent unexplained surge of severe anxiety, panic attack. Most patients develop a fear of repeat attack or or the implication of an attack. Often seen in agoraphobia is fear in places or situations from which escape may be difficult. Social phobia or social anxiety disorder is a marked, persistent, and unarousable fear of being observed, embraced, or humiliated in a social or performance situation such as public speaking or eating in front of others. Specific phobia is marked and persistent fear that is excessive or unrealistic, precipitated by the presence or anticipation of a specific object or situation such as flying spiders. Suffer avoid the feared object or subject or ensure it with intense anxiety. Post-traumatic stress disorder (PTSD) can occur after an exposure to traumatic event which involves actual or threatened death or serious injury or threat to the physical integrity of self or others. The person responds with intense fear, helplessness, or horror. Sufferers can be re-experience symptom flashback and avoid situations associated with the trauma, usually occur within 6 months of the traumatic event. Obsessive compulsive disorder, persistent thought, impulse, or image obsession that are intrusive and cause distress. The person attempts to get rid of this obsession by completing repetitive time-consuming purposeful behavior or action. Compulsion. Common obsession include contamination, while the compulsion may be repetitive washing or cleaning. أتمنى تكونوا استفدتوا من هذه المحاضرة. والسلام عليكم ورحمة الله.